Hello, my name is Nick Tice. The overall goal of an improvement advisor is to guide organizations to implement and sustain the use of new interventions, practices, or procedures. An improvement advisor could be part of an external agency like the National Center supporting multiple agencies and systems when they participate in learning collaboratives or breakthrough series collaboratives. Alternatively, the improvement advisor could also be a person who is within your agency and helping guide an implementation project for your agency. This within-agency improvement advisor is the focus of this video. The National Implementation Research Network, otherwise known as NERN, outlines three main areas of what it calls an implementation support practitioner. Three main principles should guide an implementation support practitioner: co-creation and engagement, ongoing improvement, and sustaining change. Each of these three principles have several core competencies that further define important skills the implementation support practitioner should use in their work. See the citations in the comments sections to get more detail about these principles and core competencies. There are two core competencies that I wanted to highlight as examples where an improvement advisor could make a big difference in your organization's implementation initiatives. The first competency is supporting ongoing improvement. The improvement advisor can help identify the need for change. They can initiate a small test. They can measure the impact of that small test, and then they can make adjustments to either A, tweak and retest, or B, begin to spread the change based on the findings from one or multiple iterations of those small tests. Improvement cycles have different names, such as PDSAs, or Plan, Do, Study, Act cycles, or STOCs, small tests of change. Whatever they are called, these improvement cycles are all about helping bring about replicable and sustainable implementation. So here, for an example, when a behavioral health clinic was trying to implement a new intervention, the improvement advisor realized they would need to make sure that families understood the purpose, goal, and structure of this new intervention. So the improvement advisor created and led a small test of change process. They drafted a short preamble in regular, non-clinical language describing the purpose of the intervention and why the intervention was important for the family. Their first cycle was simply trying out the preamble with a single family. After reading the script, they asked the family if what they heard in the preamble made sense to them, what other questions they had, and what other information would be helpful. Using this feedback, the improvement advisor revised the script and tried it out with a few additional families, each time asking the same questions to inform additional improvements. Once the improvement advisor had tested it several times, they invited a clinician to test it out as well. This is an important part of a PDSA, or Plan, Do, Study, Act cycle, ensuring that the improvement isn't dependent on a single individual, but it can be done with consistent results regardless of who is doing it. Once the clinician tested the preamble, the improvement advisor gathered additional feedback from the other clinicians, to begin to inform what type of training clinicians might need in order to use the preamble in the way it was intended. That was an example of the ongoing improvement charge of an improvement advisor within your agency. Improvement advisors' core competencies all work together to support and sustain change, sustaining change is another core competency of an improvement advisor. For example, an improvement advisor should demonstrate the competency of addressing power differentials. This competency of addressing power differentials falls under one of these improvement advisor key principles, specifically the principle of co-creation and engagement. One important way the improvement advisor should address power differentials is by ensuring family and young adult voice is part of the project's leadership, that these family and young adult representatives are paid for their expertise and time, and that project materials are written without jargon. When that same behavioral health clinic mentioned above was testing and improving versions of the preamble to improve families' understanding of the new intervention, the clinic also wanted to ensure that all staff in the agency really understood the value of the intervention from the perspective of families. So as part of the effort to address power differentials in their implementation efforts, the improvement advisor worked with family members from the clinic's parent advisory council to put together a panel discussion for the entire clinic staff. These family members were paid for their preparation time as well as the presentation itself. And it flipped the thinking about who are the expert trainers and who are the learners. While clinicians were accustomed to teaching families new skills, this strategy positioned the family members as the experts, and they uplifted the why of the intervention instead of focusing on the how. This helped clinicians deepen their buy-in and desire to learn more about the intervention as they heard just how positively it impacted families. And we know how critical this level of buy-in from the clinicians is for sustainability. Based on our experience at the National Center with many implementation initiatives, we recommend that you identify someone who can have dedicated time to serve it as an improvement advisor. For instance, a clinician whose client load is substantially reduced, or an agency senior leader whose existing portfolio is reduced so they can dedicate time to advancing and sustaining the new practice being implemented in your agency. Other ideas to keep in mind when considering who might be the best fit for the role of an improvement advisor include: one, the person's interest in focusing on change, measurement, and other key improvement advisor competencies in order to lead an implementation initiative. Two, the person's ability to have access to agency senior leadership and staff throughout this implementation process. And three, your organization's ability to support the person's efforts, for example, through additional compensation or freeing up their schedule if needed. This improvement advisor will be asked to focus on many important tasks, including measuring uptake of practice changes, to testing and assessing changes, to educating providers and senior leaders on helpful agency culture changes. Just to summarize a few main points from this video, an improvement advisor's work is guided by three main principles. One, co-creation and engagement. Two, ongoing improvement. And three, sustaining change. Each of these principles has several key competencies that the improvement advisor will use to lead implementation initiatives. Again, see the citations below for more details. The improvement advisor should be comfortable in identifying areas needing change, testing small tests of change, and measuring outcomes of these tests to further guide improvements. Thank you for taking the time to learn more about the important role of an improvement advisor during your implementation projects, and good luck in your future implementation efforts.